In Russia, COVID-19 hospitals are quickly reaching capacity as the country struggles to get its second wave of the virus under control. But authorities are resisting implementing another lockdown, a decision with major repercussions for the country's healthcare system. Our correspondent, Julia Chapman, was granted access to a treatment center for coronavirus and sent this report from Moscow.
In this exhibition hall in a Moscow park, there's something new on display. State-of-the-art facilities in a pop-up coronavirus treatment center. A lifeline for the city's healthcare system, there are now 5 makeshift hospitals in Moscow. They were built to take the pressure off existing medical centers. We experienced firsthand the discomfort of working in full PPE, and were taken inside to see how doctors are handling rising patient numbers. This facility was built during Russia's first wave of coronavirus, but it wasn't until the second that it became necessary to use it. At the moment, it's full to about 50% of capacity, but the number of cases is quickly rising. COVID-19 treatment has improved since spring, but while doctors are better prepared this time, many say their work is getting tougher.
Наверное, нельзя говорить, что это сложнее в плане организации. Наверное, это не сложнее в плане техническом обеспечения. Наверное, это сложнее в плане моральном. Мы с вами весной были абсолютно уверены, что нам надо 2-3 месяца, чтобы с этим справиться, и дальше спокойно можно будет входить в лето, в осень, зимние каникулы и так далее. Сейчас вот эта вот моральная составляющая, что это всерьез и надолго, она, безусловно, присутствует.
The flow of patients is steady. In Moscow, COVID-19 wards are 70% full. At the country's leading coronavirus hospital, not a single bed is going spare. But the capital isn't at breaking point. This time around, Moscow accounts for a smaller share of the country's overall cases. In the regions, things are far worse. In the Siberian city of Omsk, hospitals have been turning patients away, too full to take any more. Anastasia Vasilyeva is the head of an opposition-linked doctors' union. She says authorities lack the will to dedicate funds to the fight against COVID-19.
В регионах ситуация катастрофическая, чудовищная. И причем огромное количество, такой конгломерат проблем, которые просто, вот их даже, знаете, как этот клубок, и очень сложно распутать. И, в общем-то, у нас есть и деньги, есть люди, есть ресурсы. Но поскольку у нас нет взаимосвязи и отвратительная организация, то в итоге погибают люди.
The government has pledged more money to Russia's worst affected hospitals. But containing the spread of the virus also requires political will. Despite a higher rate of hospitalization, another lockdown is a distant prospect. Mass inoculation is expected in the coming weeks. Authorities are hoping their vaccine will flatten the second curve, keeping Russians on their feet and out of hospital beds. Julia Chapman, CNA, Moscow.